rasa sayangi, rasa sayang-sayangi. Lihat dari jauh, rasa sayang-sayangi. Dari mana datangnya lintah, dari gunung turun ke kali. Dari mana datangnya cinta, dari mata turun ke hati. Kalau ada sumur di ladang, boleh kita menumpang mandi. Kalau ada umurku panjang, boleh kita berjumpa lagi. Rasa sayangi, rasa sayang-sayangi. Lihat dari jauh, rasa sayang-sayangi. Rasa sayangi, rasa sayang-sayangi. Lihat dari jauh, rasa sayang-sayangi. Mesatnya peluhur jauh di awang-awang, memperkencang bangun kayak karinggang. Kuku naringga serenceng papat dengan ngeluh, ngapak mega perigi pernah tariknya dulu. Saha anu bisa nyusukan tandang cepat tentang daya bandingnya dana. Dipika gini dipika serap dosa sama, taya garing kasih lebih lawanina. Manuk dadali, manuk panggagana, parlambang sakti Indonesia Jaya. Manuk dadali, pangga koncarana, resep ngahiji, rukun sakabena. Jange, seng-senge, seng-seng jange, seng-senge, seng-seng jange, serere, kenyem denyore, kelap-kelap jange, seng-senge, seng-seng jange, seng-senge, seng-seng jange, serere, kenyem denyore, kelap-kelap mangalap bunga. Sore-sore padang bulan, ayo konco podo dolanan. Rene-rene bebarengan, rame-rame edo kekocean. Gai-gai rombulane, yen kisawang kok ngawe-awe. Koyo-koyo ngilingake, konco kabeh ojo turu sore-sore. Getah asale saka delo, potongan kok ikut tandane opo. Getah asale saka delo, yen rapat tuh atine rada gelo. Ojo ngono mas, ojo ngono, kadung janji mas aku mengko gelo. Ojo ngono mas, ojo ngono, kadung janji mas aku mengko gelo. Ojo ngono mas, ojo ngono, kadung janji mas aku mengko gelo. Kadung janji mas aku mengko gelo.
Satu lagi terakhir. Good morning, ladies and gentlemen. In a few minutes, our agenda will be started.
Hello, my name is Dinda.
And my name is Zelda.
We are here to tell you 10 things you should know about Undip.
What are they?
First, Undip or Universitas Diponegoro is located in Semarang, Central Java, Indonesia. You can reach Undip 1 hour flight from the capital city, 1.5 hours flight from Bali, or 2 hours by car from Borobudur.
Besides that, Semarang also has many tourist attractions, such as Kota Lama Heritage, Gedung Songo Temple, and many more.
Second, the name of Universitas Diponegoro was given by the first president of Indonesia, Insinyur Soekarno. He gave this name as a tribute to the university's performance in development of higher education in Central Java. Amazing, right?
Third, Undip is a home for thousands of students and faculty staff from all over Indonesia and overseas. Vertebrate plants species.
Undip is also a home for deers and a big cow statue. Fourth, Undip also has 11 faculties, 2 schools, and 169 study programs, which consists of 53 bachelor degree, 39 masters, 16 doctorates, 24 specialists, and 37 diploma.
The fifth thing really makes us proud. Undip has a long list of reputation nationally and internationally. Undip is listed in 2 major international system rankings. Such as QS and THE for World, Asia, and ranking by subject.
Undip is also ranked second in Indonesia based on Green Metric ranking system. The ranking that measures the performance of green and sustainable campus. Besides that, Undip is also included in 100 to 200 in the world, based on the THE Impact Ranking. Which is analyzed based on the performance of university against the United Nations of Sustainable Development Goals.
sixth thing is, you will get so many benefits if you study here. What are they?
You will get access to this university dormitory, Rusunawa Home, for more than 1,000 students. Green building campuses, library, high-tech laboratory, or UPT dan Bloomberg Studio, or even living laboratory, FPD, sport facilities, hospital, and many other facilities in walking distance. Everything is in here. Undip also has a twin building, not this building Petronas, but more like this building, ICT Center. And here, we can also find Golden Gate Bridge. But in the super tiny form and installed in the arch style. It's called Sikatan and Sicebong. And we also have the miniature of Lake Kariba, which called Diponegoro Reservoir. Seventh, Undip has a commercial professional radio channel under the name Pro Alma. You can also listen to Pro Alma through streaming Pro Alma YouTube channel.
8. Undip has 6 campus locations in 6 different cities. They are located in Semarang, Rembang, Pekalongan, Demak, Batam, and Jepara. Wow!
9th, Undip use some of renewable energy sources, including solar panels, chillers, and clean biomass or biogas, as well as hydropower.
The last thing you should know is that Undip also manage 1 hectare campus forest inside the main campus. And 100 hectare campus forest outside for research and management in the forestry. Biological resources and environment sectors. So, what are you waiting for? Join us now here at Universitas Diponegoro. Conducting research for humanity.
Ladies and gentlemen, we will have a safety induction by Universitas Diponegoro Occupational Safety and Health students.
Safety Induction. Honorable guests, ladies and gentlemen, we are the students of Occupational Safety and Health Faculty of Public Health Diponegoro University as the Occupational Safety, Health and Environment Unit Team. Before starting the activity, and in accordance with the procedure and standard of occupational safety and health in online activity, please pay attention to the procedure and compliance in occupational safety and health. Position yourself in a proper sitting posture. Do some stretching exercises to prevent musculoskeletal disorders. Adjust the visibility and brightness of your screen. Be aware of electrical hazards such as overloading electrical outlets. Ensure your area is safe from other potential hazards. Ensure a stable internet connection, camera, and microphone during the online meeting. The risks and hazards that probably occurred are fatigue, fire, and earthquake. When the emergency occurs, keep calm and do not panic. If the situation is deemed safe, please proceed to the nearest open space around you by lowering your head and body to avoid the smoke and debris. If you need assistance, please directly contact the public service center around you or emergency call 112. Thank you for your attention. We wish you an enjoyable event. Keep your health and safety first. Safety first, prevent the worst, let's embody zero accident.
Ladies and gentlemen, please kindly use the virtual background provided by the committee. Please rename your Zoom username to the format UND_name for invited guests from the Ministry of Health Indonesia, article ID_name for presenter, and NP_name for non-presenter. And lastly, please fill in the attendance link in the chat box. Welcome to Universitas Diponegoro.
Undip move forward with a new spirit and tagline, noble and valuable. This spirit must become the driving force behind all aspects of our Tridharma activities, academic, research, and community services. Noble reflects the spirit and commitment to always uphold the values of humanity.
Versi ini memiliki masa yang lebih ringan dibandingkan versi yang sebelumnya. Dan kami sertai dengan teknologi Android untuk bisa mengubah pola gerakan yang akan digunakan oleh pasien.
We are determined to become a world-class university, to be part of global epistemic community that continues to carry out reproduction of knowledge for the future of humanity.
Terkait tantangan global, keuangan yang stabil diharapkan keuangan domestik juga tetap solid.
Valuable signifies our unwavering commitment to remain connected with societal challenges.
Ini air laut, ini air dari mesin desalinasi siap minum.
We strive to consistently be a proactive agent of change, delivering solutions for the various problems of the nation.
Sebagai bentuk pengabdian kepada masyarakat, kami siap menyehatkan masyarakat dan memasyarakatkan kesehatan.
We are determined that Universitas Diponegoro will continue to strengthen its competitiveness on the international stage, fulfilling its vision as a world-class university by producing exceptional and highly skilled graduates.
University is from Indonesia, Diponegoro University.
With a new spirit and tagline, noble and valuable, we are confident UNDIP can make a meaningful contribution to local and global communities.
UNDIP
Bermartabat! Bermanfaat!
This event is presented by Public Health Faculty Universitas Diponegoro.
As part of Universitas Diponegoro, a university dedicated to being kampus berdampak or impactful campus, we believe that higher education must transcend academic achievement. It must serve as a driving force for social progress, community empowerment, and sustainable development.
Our vision is to become an internationally recognized center of excellence in public health higher education.
We have 7 study programs: undergraduate program of public health, undergraduate program of occupational safety and health, master of health promotion, master of public health, master of environmental health, master of epidemiology, and doctor of public health.
Our research is rooted in prevalence, whether addressing maternal and child health, environmental health, health system management, occupational safety and health, or epidemiology. We aim to generate insights that inform policy and drive change. Through partnership with governmental institutions, NGOs, and global health agencies, we ensure that our work has reach and resonance. We also recognize that public health is a global pursuit. That is why we foster international collaboration, providing our students and researchers with opportunities to contribute to cross-border health solutions and global learning networks. The programs are for degree program and non-degree program such as International Class, International Conference of Public Health, Tropical and Coastal Development, Summer Course, Student Goes Internationals, inbound and outbound students. We are committed to improve the quality of the education process by enriching knowledge through visiting professors from top international universities, general lecturers from many reputable universities.
This is my first visit, and I hope it'll be the first of many, and I hope that some of your students will perhaps come and join us to study at postgraduate level in Dundee in the near future.
We also focus on the development of sciences and discovery of new findings through research from upstream to downstream, joint research with many reputable universities and international NGOs, international and national publications, including joint publications with professors and lecturers from international universities. Our research also resulted to some inventions that are registered to the patents and intellectual property rights. Community service are also one of our main concerns. We are committed to always contributing to solving public health problems at the local and national levels through networking, community empowerment, and many more. And furthermore, we also published the results in some accredited journals of community services.
We are committed to improve the quality of the human health resources and community quality of life through public health higher education at any level.
Therefore, we have high-quality lecturers and academic staffs. As per today, we have 9 professors, lecturers graduated from top global universities and top national universities as well. To support the lecture activities, we provide laboratories with sufficient tools and equipment. We trained our lecturers and the academic staff to improve our quality according to the technology development. We also have joint research and publications with national and international institutions such as NTU, ANU, UMS, UKM, Mahidol University, Yonsei University, Gangwon National University, Chungbuk National University, Seoul National University, WHO, UNICEF, UNAIDS, and many more. We also facilitate non-academic activities for students and all academic staffs, such as basketball field, volleyball field, and bicycle. We also facilitate academic activities such as library, online library, discussion rooms, and journal rooms. We also support students' achievements and accomplishments in local, national, and international competitions.
I love studying public health because it's impactful and contribute in the regulation and the quality of life and wellness of Indonesian people health.
We achieved 10 years lost time injury free.
Our impact to them is to make them working safely so they can back to home to meet family.
So I think the role of the alumni and the role of the public health is really significant in actually improving the status of the health globally.
Our alumni are a testament to our values. They are public health professionals, researchers, policy advocates, and change makers, leading initiatives in Indonesia and beyond. The Faculty of Public Health Universitas Diponegoro, educating with integrity, innovating with purpose, leading with impact for the nation and for the world. Together we strive, together we thrive.
The Honorable Minister of Health, Ministry of Indonesia, Mr. Budi Gunadi Sadikin.
The Honorable Rector of Universitas Diponegoro, Professor Dr. Suharnomo, BEc, MSc. The Honorable Head of Reputation, Partnership, and Global Connectivity Office of Universitas Diponegoro, Professor Dr. Hadianto, MSc.
The Honorable Head of Central Java Provincial Health Office, Yunita Dia Suminar, BSPH, MSc.
The Honorable Dean of Public Health Faculty, Universitas Diponegoro, Associate Professor Dr. Budiono, BSPH, MPH.
All of the Honorable Deans and Vice Deans of Universitas Diponegoro.
The Honorable Speaker, Technologist Dr. Ismaniza Ismail from University Teknologi Mara, Malaysia.
Assistant Professor Isara Siramanirat, PhD, from Raja Manggala University of Technology, Thailand.
Professor Elena N. Naumufa, PhD, from Tufts University, USA.
Shetan BSc, MPH, PhD, from National Center for Epidemiology and Population Health, Australian National University, Australia.
Professor Dente Zahro Saluya, MPH, PhD, from Faculty of Public Health, Universitas Diponegoro, Indonesia.
The Honorable Moderator, Professor Hanifa Maherdeni, BSPH, MPH, PhD, Faculty of Public Health, Universitas Diponegoro, Indonesia.
Professor Dr. Marta Iren Kartasurya, MSc, PhD, from Faculty of Public Health, Universitas Diponegoro, Indonesia.
Muh Fauzi, BSPH, MS, PhD, from Faculty of Public Health Universitas Diponegoro, Indonesia, and all of the participants of this conference. Welcome to the
6th International Conference on Public Health for Tropical and Coastal Developments, Public Health Resilience in Tropical and Coastal Areas.
Ladies and gentlemen, it is now time to sing the national anthem of Indonesia, Indonesia Raya, and followed by hymn of Universitas Diponegoro. Please sit in your own place properly.
Indonesia
Ladies and gentlemen, before we begin our agenda, let us pray together. Prayer begin. Prayer ends.
The honorable participants, as one of 5 leading faculties of public health in Indonesia, that means we have responsibility to improve public health at national and international level. So this event is a great opportunity to exchange information about what is happening in the world and their solutions for local, regional, and global scale.
Build network in research and community empowerment among countries to increase the quality of life.
A media to raise awareness and experience for researchers, students, policymakers, and stakeholders.
For the government and stakeholders, this conference can help to formulate strategies for sustainable development in public health field.
Improve knowledge and students' ability to present the results of their research in public health.
This conference is supported by BTN Bank.
Kini hadir Balai Solusi saat kemudahan dan fleksibilitas menjadi satu. Dibekali HR platform modern yang akan memudahkan tugas kamu. Memberi fasilitas terbaik bagi karyawan dengan bunga khusus BTN. Literasi dan perencanaan keuangan mumpuni, hingga berbagai loyalty program menarik, dashboard digital, layanan khusus untuk kebutuhan mendesak sebelum gajian,
ya, makasih.
Dan pastikan layanan istimewa terpenuhi. Lengkap dan mudahnya ragam solusi ini hadir untuk apapun jenis usahamu. Bergabunglah dengan Balai Solusi sekarang. Layanan payroll, transaksi, pinjaman.
Good morning, everyone. My name is April, and I'm here with my partner.
Good morning, everyone. I am Mima.
We are honored to be your master of ceremony of this event. It is an exciting event where we gather to discuss about the latest public health topic.
Ladies and gentlemen, it is time for a welcoming speech from the Dean of Public Health Faculty Universitas Diponegoro. Please join us in a warm welcome for Associate Professor Dr. Budiono, BSPH, MPH. The time is yours.
Thank you, Mima and April. Bismillahirrahmanirrahim. Honorable Minister of Health of the Republic of Indonesia, Budi Gunadi Sadikin, Rector of Universitas Diponegoro, Professor Dr. Suharnama Bachelor in Economics, Master of Science, Director of Reputation, Partnership and Global Connectivity Universitas Diponegoro, Professor Dr. Engineer Hadianto, Bachelor in Technique, Master of Science, Principal Professional Engineer, Head of the Central Java Provincial Health Office, Yunita Diah Suminar, Bachelor in Public Health, Master of Science, Director of Dr. Karyadi General Hospital Semarang, Chair of the Collegium of Public Health, Collegium of Environmental Health, Collegium of Health Epidemiology, and Collegium of Health Entomology. Esteemed Vice Rectors, Deans and Vice Deans of Universitas Diponegoro, distinguished speakers and presenters from across the globe, dedicated organizing committee, valued guests and participants, good morning, selamat pagi, Assalamualaikum warahmatullahi wabarakatuh. On behalf of the Faculty of Public Health, Universitas Diponegoro, it is my profound honor and privilege to extend a warm welcome to all of you at the 6th International Conference on Public Health for Tropical and Coastal Development, ICOPH-TCD 2025. Since its inception in 2016, ICOPH-TCD has grown into a cornerstone of global collaboration, uniting scholars, policymakers, practitioners, and community leaders to address the pressing public health challenges faced by tropical and coastal regions. This year, under the term Public Health Resilience in Tropical and Coastal Areas, we confront the urgent needs to fortify health systems against the complex interplay of climate change, natural disasters, vector-borne diseases, and socio-economic vulnerabilities. These regions, vibrant with biodiversity and cultural heritage, demand innovative, sustainable, and culturally attuned solutions to ensure equitable health outcomes. ICOPH-TCD 2025 serves as a dynamic platform to share knowledge, forge partnerships, and inspire transformative action to address these challenges. We are privileged to host distinguished speakers from Indonesia, Thailand, the United States, Australia, and Malaysia, whose expertise will enrich our discussions. Joined by about 300 presenters and participants from 10 countries, including nations such as Thailand, Malaysia, Australia, Pakistan, Uzbekistan, Poland, Rwanda, Ghana, Gambia, and Nigeria. Among others, this conference reflects a truly global commitment to public health. Their contributions will span critical fields such as biostatistics and demography, health promotion, occupational health and safety, reproductive health, epidemiology and tropical diseases, entomology, public health nutrition, environmental health, health administration and policy, and more. ICOPH-TCD 2025 is more than a conference. It is a catalyst for global impact. To this gathering, we aim to spark interdisciplinary research, foster academic and community partnerships, and amplify high-quality publications in reputable journals and proceedings. The call for papers and special sessions on rural health issues will further elevate the global discourse on public health. We also look forward to cultivating opportunities for visiting lectures, student exchanges, and collaborative research with institutions worldwide, strengthening the Faculty of Public Health role as a leader in this domain. My deepest gratitude goes to our speakers, particularly the Honorable Minister of Health, for sharing their visionary insights. My heartfelt thanks also extend to the organizing committee for their relentless dedication and to all participants, whether joining us in person or virtually, for your passion and commitment to advancing public health resilience. I also express my appreciation to our rector, Professor Dr. Suharnomo, Bachelor in Economics, Master of Science, for his unwavering support in advancing Universitas Diponegoro's mission of academic excellence and societal impact. As we embark on this journey of collaboration and innovation, let us unite in our shared vision to build healthier, more resilient, and equitable communities. May ICOPH-TCD 2025 inspire you, connect you, and empower you to drive meaningful change. Thank you. Terima kasih. and may you have an enriching and transformative experience at ICOPH-TCD 2025. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much for Associate Professor Dr. Budiono, PSPH, MPH for the welcoming speech.
Ladies and gentlemen, for the opening ceremony, we would like to request the Honorable Rector of Universitas Diponegoro, Professor Dr. Suharnomo, BEC, MSc. The floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, honorable keynote speakers, Bapak Budi Gunadi Sadikin, the Minister of Health, Republic of Indonesia, invited expert speakers, Professor Elena Nomova, PhD, from Tufts University, United States, Professor Yotin Sawangdi, PhD, from Mahidol University, Thailand, Season PhD, from National Center for Epidemiology and Population Health, Australian National University, Australia, Professor Zahroh Saluhiyah, PhD from Universitas Diponegoro, Indonesia, Dr. Ismaniza Ismail from University Teknologi Mara, Malaysia, Vice Rectors, Dean of Faculty of Public Health, the moderators, presenters, and all participants. As a rector of Universitas Diponegoro, I welcome you to the 6th International Conference on Public Health for Tropical and Coastal Development, organized by the Faculty of Public Health. I thank to the committees for managing this conference. Universitas Diponegoro has provided quality higher education for 68 years. It is rewarding to see the university achieve significant milestone. Undip has shown significant improvement in its World University ranking. In 2025 edition, Undip ranked 721 globally, rising from 1001 in 2022. This trajectory reflects the university's effort to enhance its academic quality and reputation. The highest ranking considers academic reputation, employer reputation, faculty-student ratio, citation, international faculty ratio, and international student ratio. This ranking placed Undip among the top universities in Indonesia. As we know that Undip has 11 faculties, a postgraduate school and a vocational school, serving more than 53,000 students. The university's improved ranking aligned with its A, excellent accreditation and recognition for best graduate employability in Indonesia by KS top universities. Distinguished guests, esteemed colleagues, and members of our academic community, today we address critical issues that demand immediate attention: public health resilience in tropical and coastal areas. As climate change reshaped the world, this region faces intensifying challenges that require innovative solutions and commitment. Our approach encompasses developing climate-adaptive health systems, managing vector-borne disease, and improving the water and sanitation infrastructure. We must prioritize food security, mental health support, and coastal ecosystem protection. Our strategy includes health stress management, strengthening of health information system, capacity building, and collaborative governance. These interconnected aspects form the foundation of the resilient public health framework that can withstand and adapt climate change. As we explore this topic, collective expertise, dedication, and innovation are crucial in safeguarding the health of communities in tropical and coastal areas. Universitas Diponegoro, with its public health expert and laboratory support, has advanced to become a leading research university committed to enhancing community health. In this event, speakers from 5 countries will share vital experiences and insights to help combat climate change. We hope that this will foster a network between Universitas Diponegoro, particularly the Faculty of Public Health, and universities worldwide, enabling innovation to address health challenges in Indonesia. We aspire to this conference to inspire ideas for a brighter future for our life and environment. This conference serves a platform to disseminate research findings, share scientific argument and best practices, and engage in discussion on current issues encompassing policy and practice across contexts. We expect this conference to yield a synthesis of multidimensional approaches from both speakers and presenters. The university congratulates the Dean of Faculty of Public Health for organizing this international seminar and welcoming distinguished guests from various countries. In conclusion, Undip extends its heartfelt wishes for your continued process. We sincerely appreciate your presence with us today. Thank you again for joining us. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much for the opening speech that has been delivered to us.
Ladies and gentlemen, with that, the 6th International Conference on Public Health for Tropical and Coastal Development is now officially open. Dearest participant, to enrich the next event, let us enjoy a video performance that uniquely represents the cultural diversity in Indonesia, performed by Studio 8.
Studio 8 is a student organization who have joined so many national and international competitions.
Gugur Gunung Dance is a traditional Javanese dance that embodies the spirit of gotong royong or mutual cooperation.
The phrase itself means descending the mountain, symbolizing people coming together from different places to work hand in hand for a shared goal, often in the context of community development or helping one another in times of need. Ladies and gentlemen, we present Gugur Gunung Dance!
Ladies and gentlemen, let's start the conference agenda with our keynote speaker. We are honored to have a Minister of Health of Indonesia. Please welcome Mr. Budi Gunadi Sadikin, Minister of Health Indonesia. The time is yours.
Ladies and gentlemen, before we hear the speech of the Minister of Indonesia, Minister of Health of Indonesia, we would like to announce some information for you. Please kindly use the virtual background provided by the committee, and please rename your Zoom username to the format UND_name for the invited guests from the Ministry of Health, article ID_name for the presenter, and NP_name for non-presenter. And also, don't forget to please fill in the attendance link in the chat box.
Ladies and gentlemen, let's start the conference agenda with our keynote speaker. We are honored to have a Minister of Health of Indonesia. So please welcome Mr. Budi Gunadi Sadikin, Minister of Health of Indonesia. Dearest participant, please kindly wait for a while because right now the Minister of Health is on process to joining the Zoom meeting. And we would like to announce once again for all of the dearest participants, please kindly use the virtual background provided by the committee and please rename your Zoom username to the format of UND_name for invited guests from the Minister of Health of Indonesia, article ID_name for presenter, and NP_name for non-presenter. And lastly, don't forget to please fill in the attendance link in the chat box. Ladies and gentlemen, please kindly wait for a while because right now the Minister of Health of Indonesia is on process to joining the Zoom meeting. Dear participant, I would like to announce once again to confirm your attendance for today's plenary session for ICOPH-TCD 2025. Please kindly fill out the attendance form at the following link that has been sent into your chat Zoom. We truly appreciate your participation.
The honorable participants, once again, to help us identify all the attendees properly that has been attended during the ICOPH-TCD 2025 seasons, I kindly ask you to do some things. So please kindly use the virtual background provided by the committee. Please rename your Zoom name to the format UND_name for the invited guests from Ministry of Health, article ID_name for presenter, and NP_name for non-presenter. And also please fill in the attendance link that has been shared in the chat box.
Ladies and gentlemen, let's start the conference agenda with our keynote speaker. We are honored to have a distinguished representative from the Ministry of Health of Indonesia. Please welcome Director General for Health Policy, Mr. Asnawi Abdullah. The time is yours.
Terima kasih. Thank you so much. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, on the behalf of the Ministry of Health, I would like to share the topic towards sustainability healthcare in Indonesia, the Ministry of Health Strategic Plan 2025-2029. As you all can see this slide, the Ministry of Health have done big bang reform health system transformation. Indonesia have 6 pillars of transformation to support Indonesia health system as the basic, as the foundation to make healthy Indonesian people. Health system transformation is in line with the vision of the President to create healthy, productive, independent, and fair. This is also in line with the outcome of RPJMN on health system, which focus on 5 aspects. Indonesia aim to improve the children health, family planning, and reproductive health. Indonesia also want to accelerate improvement of community nutrition, also improve disease control. In the 4th outcome of health system transformation, we want to create a healthy movement culture. And the 5th outcome of Indonesian 5-year health system plan is to strengthen the health system as well as medicine and food control. So then the Indonesia government, particularly the Ministry of Health, propose 6 pillars of transformation. As you can see here, the first health system transformation pillar focus on transforming primary healthcare. We aim to strengthen the role of voluntary health cadre, campaigning and building movement through digital platform and through community empowerment and community leader. The second part of primary healthcare transformation is shifting the focus of the policy from curative paradigm to primary prevention, secondary prevention. And also in this first pillar, primary healthcare transformation, we also aim to improve the capacity, the capability of primary healthcare. We believe by strengthening primary healthcare, we can create a better health system. We can create a foundation health system, and we can create a better, healthy lifestyle of our community. The second pillar is to improve secondary healthcare, particularly related with the hospital. How to create hospital easily access to the community, how to provide the hospital with better quality of care, and how to create the hospital close to the community, particularly in a remote area. In this year and next year, Indonesia government tried to build 60 new hospital in a remote area. The third pillar is related how to create our health system more resilient. We learn from a pandemic how fragile our system is, and then learning from the pandemic experience, Ministry of Health aim to create a health system more resilient to face any issue, any pandemic, any outbreak in the future. By improving resilience of pharmaceutical, medical device sector, we try to reduce our dependence on import equipment, import medical device. Another strategy try to improve health system resilience by increasing or by strengthening emergency response resilience. Another pillar of health system transformation related with health financing transformation. This pillar aim to regulate health financing with three objectives: availability, sufficient, and sustainable. We want to have health financing fair in allocation, effective, and also efficient. The fifth pillar of health transformation related with health talent transformation. And the last pillar of transformation is using health technology in all health services delivery. We focus on information technology. We also we focus on biotechnology. By strengthening this sixth pillar, we believe we make our health system in the future more resilient, and we also can achieve to create the healthy population in the future. I think this is sixth pillar of transformation. Some people believe the Indonesia have done a big bang reform with this sixth pillar. And also you aware Indonesia recently introduced the screening program Cek Kesehatan Gratis. The philosophy of cek kesehatan gratis or screening is to change the perspective of our society. They should aware of their health condition. They should concern with their risk factor if they have. That's why we encourage all Indonesia citizens to do cek kesehatan gratis at least one in a year. So later on, we can change the perspective of the community. They should go to the hospital, should go to the clinic, should go to the puskesmas when they are healthy, not only go to the puskesmas or to health clinic when they have a problem with their health. So this is cek kesehatan gratis or CKG. We want to shift the paradigm of our society. I think this six pillar that I would like to share to you, I hope give some idea how Indonesia health system right now we focus and the mission of the health system transformation. I think that's all what I can say. Thank you so much.
Thank you so much to Professor Asnawi Abdullah, PhD, for this speech that has been delivered to us.
Ladies and gentlemen, to commemorate this event, we would like to capture a virtual group photo with all of the participants. Please kindly enable your camera and show us your best smile.
We would like to invite everyone in this room to open up your camera, show us your best smile, to take this documentation with us.
And don't forget to hold your pose and smile for a little while because there's a lot of page to take a photo with.
I can see some of participants here open up their camera, but I would like to invite more participants to open up your camera with us to take this documentation.
Ladies and gentlemen, there are a total of 16 slides for the photo session, so please kindly hold your pose and also show us your best smile. And maybe we will start the photo session right now.
All right. Everyone, please show us your best smile and say cheese in 3, 2, 1. Cheese. All right. We will move on to the next slide. Please hold your pose together with us to take this documentation. Everyone show your best smile and say cheese in 3, 2, 1. Cheese.
All right, maybe move on to the next slide. Please show us your best smile and I will count from 1, 2, 3. Cheese. All right, to the next slide. Don't forget to show us your best smile. 1, 2, 3. Cheese. All right, maybe next slide. 1, 2, 3. All right, everyone. Thank you so much for participating to this photo session and show us your best smile. Dearest participant, for the next plenary session, we would like to invite our moderator, Professor Hanifa Mahardeni, BSPH, MPH, PhD. And I would like to mention some of her profile. Professor Hanifa Mahardeni, PhD, is a distinguished professor with international recognition in occupational health, public health leadership, and academic governance. Proven track record in leading organizations, advancing research, and fostering global collaboration. Passionate about improving public health system through evidence-based policies and capacity building. For Professor Hanifa professional experience, the latest one is a professor in Department of Occupational Safety and Health in Diponegoro University. For Professor Hanifa leadership and professional affiliation, the latest one is a chair in Collegium of Occupational Health and Safety, Council of Health Indonesia from 2024 until 2029. And for her consultancy and collaboration is the expert consultant for WHO, ILO, and the Ministry of Health of Indonesia in occupational health projects. And for her education and awards, you may see it on your screen. So without any further ado, let's welcome Professor Hanifa Mahardeni, BSPH, MPH, PhD with a big applause.
Thank you very much, Master of Ceremony and distinguished guests in this conference. I would like to say hello and good morning to the Honorable Dean of Faculty of Public Health and also the representative of Ministry of Health and also the chair of the Collegium of Public Health, Collegium of Occupational Safety and Health, a Collegium of Occupational Health and Safety, Collegium of Environmental Health, Collegium of Health Promotion, and Collegium of Epidemiology. So, and then Collegium of Nutrition. Also, I think this is also under the umbrella of Faculty of Public Health. So this session, in this plenary session, we would like to present two of the distinguished speakers, Dr. Dr. Ismaniza Ismail from the University Technology Mara, Malaysia. She is going to present adapting occupational hygiene practice to enhance resilience in coastal regions. And then the second speaker is Dr. Isara Siramanerat, Associate Professor from Rajamangala University of Technology, Thayamburi, Thailand. She is going to present the reproductive health and elderly. So for the first presenter, I would like to give the screen to Dr. Ismaniza. However, I would like to present her curriculum vitae. Kindly allow me to share screen of her curriculum vitae. Can you see my share screen? Somebody can validate if my share screen is visible or not. Okay. TS Dr. Ismaniza Ismail. I apologize. What is the abbreviation of TS? And she has obtained her educational status and PhD in occupational and environmental hygiene from the University of Adelaide, Australia. And then institution, she is attached to the current institution of Faculty of Applied Sciences, University Technology, Mara. And then current position, Senior Lecturer, University Technology, Mara, Industrial Hygienist, Safety Consultant, Trainer in Malaysia from the Malaysian Safety of Occupational Safety and Health, or MSOOSH. And then trainer at Itetium, Shadan Shadan Bender. It's a tutor subject matter expert, Open University Malaysia. Apologize for the abbreviation. And then she has also an expertise of occupational and environmental hygiene risk assessment, industrial safety, public health, and environmental biotechnology. So, and then beside her extensive experiences in the field of environmental occupational health, she has also 35 article publication in Scopus Index journals with H Index 3, and this is among the selected publication. Determinant factors of physical and mental health problem of adolescent internet users in high school in Makassar, and then development of noise-induced hearing loss prediction model using Leavenworth, Marquardt, and then practice toward managing psychological risk in the workplace, and then Pasir Gudang tragedy, 3 years aftermath of disaster preparedness, and 9th International Graduate Conference on Engineering, Science, and Humanity. So, Dr. Ismaniar, I think this is the screen and the session is yours now. Please. Thank you.
Okay, thank you very much, Prof. Hanifa. Okay, can you hear me very well?
Yes, it's crystal clear.
It's been quite a while since I met you online.
Indeed.
Okay. Assalamualaikum and a very good morning. Okay. Thank you to the organizers of the conference for having me. Okay. And thank you for the kind introduction as well from Prof. Hanifa. Today, I want to share how adapting occupational hygiene or OH practices can help protect and empower coastal communities who are increasingly vulnerable to climate threats. Let's explore this intersection of workplace health, climate adaptation, and resilience. Okay, and so coastal regions are more than just scenic zones. They are bustling ecosystems supporting over 40% of the world's population. They drive fisheries, maritime trade, tourism, and offshore energy, all those vital contributors to national and global GDP. Many workers here operate in informal, high-risk environments and often overlook informal OH policies. And we're not just seeing climate change, we are inhaling it, sweating through it, and maybe dying because of it. Any disruption like climate, economic, or health ripples through livelihoods, food systems, and national stability. So occupational hygiene must evolve to meet these challenges. Okay, let's have a look at these maps. Okay, the first one on the left-hand side highlights the population concentration within 100 kilometers of coastlines and areas of high environmental alteration. Okay, and the second one, it identifies low-lying coasts, islands, and mega cities vulnerable to sea level rise. Yep. And this one, the sea level rise flooding risk zones that showcases major coastal hotspots in South and Southeast Asia and beyond. Okay, so which may be more relevant to most of us here. And the one on the this one. Okay, this one displays the densely inhabited coastal zones, particularly in Asia, along with subsidence-prone regions. Okay, and as shown, approximately 3 billion people live within 200 kilometers of a coastline, with half in highly degraded coastal zones, which means that low elevation coastal areas, which is less than 10 meters above sea level, include major megacities and island nations, indicating extreme vulnerability. And regions across South and Southeast Asia face combined threats like dense population, land subsidence, and also increasing flooding risk. Okay, moving on. Coastal work already comes with hazards, shifting weather, isolation, unpredictable marine conditions, and climate change, adding it to the mix, and this becomes amplified. Okay, so we see increasing incidence of occupational injuries, stress-related disorders, and exposure to new environmental agents. Okay, here we have fishermen in Indonesia facing harmful algal blooms outbreaks, which is linked to respiratory and neurological symptoms. Maybe desalination plant workers exposed to brine aerosols, okay, from the seawater, causing eye irritation, respiratory discomfort, and also skin issues. Port workers may be exposed to diesel fumes and handling hazardous chemicals, and not forgetting hospitality staff, as the picture down there. Okay, like tourist guide, okay, may have to endure heat stress, long hours, and also poor ergonomics. And these evolving risks demand more than just traditional safety approaches. They require agile, adaptive occupational health thinking. So we have to be prepared for it, in other words. Okay, let's zoom into some of the climate-related OH stressors. Okay, as you can see here, the climate change, heat waves may increase frequency that leads to heat exhaustion, dehydration, and decreased productivity in outdoor work. Okay, and this is particularly common for construction industry and also tourism industry. Okay, flooding, recurring flooding damages workplace infrastructure and leads to water contamination, creating sanitation and mold issues. Okay, post-disaster cleanups in low-lying coastal Bangladesh or the Philippines, where cleanup workers face exposure to hazardous debris, contaminated water, and lack of PPE. Okay, more proliferation, like after cyclones or monsoon rains, prolonged dampness increases mold exposure in confined workplaces, vector-borne disease, such as warmer, wetter climates. Okay, this is pretty common in Malaysia and Indonesia particularly, where mosquito habitats, okay, is very common, increasing cases of dengue, malaria, and leptospirosis as well among outdoor workers. And many workers are also exposed to overlapping physical, biological, and psychological stresses simultaneously. And let's not forget compound risks, where multiple hazards hit all at once. Okay, so how do we respond? We can start with innovation. Okay, first we have wearable sensors that can track temperature, exertion, and pollutant levels in real time. Maybe mobile weather alerts that can help schedule work safely and prevent unnecessary exposure. Here we also have salt-resistant infrastructure that reduces breakdown in ports and coastal sites, as shown in the picture down there. And modular system that support continuity even during storm surges. So technology must serve both productivity and also protection at the same time. It's not just about equipment, we must also empower people, like climate adaptive PPE, the gear that protects without overheating, optimize rest work cycles using apps or AI to schedule breaks based on environmental data, and also community early response networks, okay, where people would know how do they respond and what do they do during emergencies. And Also, not forgetting the exposure forecasting system that combine weather and health, and also job data to preempt risk. Okay, so resilience must be built into both physical systems and also social systems. All right, let's shift to real-world inspiration. Examples from 4 regions that face adversity and innovated. Okay, we have Japan, the Gulf of Mexico, Bangladesh, and also the Netherlands. Each offers unique lessons in integrating OH with broader resilience strategies. Okay, for Japan, they have integrated tsunami evacuation drills with workplace health programs in fishing villages. And I think this is pretty common because at one time when we had tsunami, okay, Japan was also badly affected. Okay, but they are very well prepared following that episode. Okay, Gulf of Mexico, where they have offshore rigs that now use AI and also robotics to reduce direct exposure to dangerous tasks. Bangladesh, okay, they have cyclone shelters that double as safe workplaces. So their communities are also now trained in occupational hygiene basics. Okay, so it is very important to make sure that everybody knows what to do in cases where there's an emergency. Okay, and Netherlands, a model of participatory planning, port workers help co-design flight policies. And these show that adaptation is not only possible, okay, it's scalable when rooted in local knowledge. Okay, the image that we have here visually represents coastal regions with varying degrees of vulnerability. Okay, while these 4 specific images does not include, these images does not represent all 4 locations mentioned there, Japan, Mexico, Bangladesh, and Netherlands. It captures the concept of mapping coastal risk areas with markers. Yeah. So now that we know all these case studies that has happened, okay, and these are the lesson learned. Yeah. So this also means we don't have to say that we are not prepared for it because nobody has done it before. Okay. So where should we go from here? All right. This funnel diagram shows a research pipeline from local data collection to regional policy making. Okay, for citizen science, okay, we can train coastal workers to collect occupational hygiene and climate exposure data and build ownership from there. Okay, for regional academic partnerships, okay, we can learn from each other because climate doesn't respect borders. It's just like Malaysia and Indonesia, we do have a similar climate. So maybe we can collaborate together. Okay, and as for other countries which may have a different climate, we can always learn something from them. Okay, because they have experienced it, maybe they can teach us something that we haven't done before. Okay, regional academic partnerships, longitudinal cohort studies, that is by tracking long-term occupational health effects of coastal exposures. This is because it is in the coastal region. It means that it's specific. The trend is pretty similar because when it comes to brine, okay, it comes to working in heat, okay, that is a common thing regardless of wherever you are, as long as you are in the coastline. So we need more evidence, yes, okay, but also more equity in who contributes to that evidence. All right, I'd like to leave you with 5 key messages, yeah. Be proactive, okay, because prevention saves lives, okay. Be locally informed, okay, because one size does not fit all, which means that if we adapt it from the global or region, okay, the other regions, we have to make sure that it is adaptable to our situation. As I said just now, although it is pretty similar in terms of the effects, okay, what happens in Bangladesh, in Japan, okay, but keep in mind whatever that they practice may not be adaptable in our countries. Okay, take an integrated approach. Well, we can bridge occupational hygiene with public health, okay, urban planning and disaster risk. Okay, that's how I expand my expertise, because it is not only about exposure assessment. It's not only about what is being experienced by the what we call that by the workers, because what is exposed to the workers, okay, will affect their health. Okay, if it affects the workers' health, it may also affect the public health. All right, and with that, we need a good urban planning, okay, and also disaster risk management, in which one can lead to another. Okay, if one thing happens, so if, for example, if a disaster happens, there's a flood event, there's tsunami and such, it will not only affect the workers, it will also affect the public. Okay, ensure participation, such as postal workers, designers, not just recipients. They may think that, oh, we are just workers, we don't know anything. Okay, but while they can also be involved in terms of giving inputs for policymakers. Okay, and think sustainably. Okay, because adaptation must endure and not just react. Okay, so it is a long-term progress that we aim to achieve. Okay, it doesn't stop there. Okay, because you know, disaster may happen in the future. Okay, and to those who live in the coastal regions, this is a never-ending problem. Okay, we can no longer treat occupational hygiene as a separate entity from environmental or climate policy. So it must be central and interrelated. Okay, so with that, I thank you very much for your time and attention. I welcome questions or collaborations from the floor. Thank you.
Thank you very much, Dr. Ismaniza. So we would like to go to the second presenter, Dr. Izara. So kindly allow me to share screen. Wait, aduh, there is something. Yeah. Excuse me, this is macet. Sorry. Okay.
I'm here.
Okay, welcome, Dr. Izara. Okay. CV-nya. Sudah ditayangkan? Okay. Thank you. Can you see my share screen? Yeah.
Yes.
So, kindly allow me to read Dr. Isyara's curriculum vitae. So Dr. Isyara is a philosophical doctor and demography from Institute for Population and Social Research at Mahidol University, Thailand. And then her department attachment is Department of Social Science, Raja Mangala University of Technology, Tanjamburi. And then her current position is lecturer in the Department of Social Science at Raja Mangala University of Technology, Tanjamburi. And her expertise is demography and sociology of health and illness. And then she also published quite so many publications. However, among those publications, there are 23 articles in Scopus Index Journal with the H index of 5. Among those are type of mass media exposure, effect on Zika related knowledge, and behavior among pregnancy women in Thailand, and then perception of Zika virus infection and its influence on Zika preventing practices of pregnant women and women at the Health Promotion Center, Region 5 in Thailand. and then demographic factors, environmental factors, and performance of personnel of the Ministry of Public Health, and then knowledge, attitude, and behavior toward premarital sex among adolescents in Indonesia. However, before moving to the presentation of Dr. Isimara, kindly allow me to read the information for the participants of this plenary session. First, for the participants, kindly requested to follow the presentation in an orderly manner. It's okay. I mean, according to the guidance, and then questions can be submitted by writing them in the chat box using the following formats: name, institution, and then address to which speaker, question content, example. Format will be provided by the committee in the chats. Yeah, so follow the chat box. And then those who wish to ask questions in Bahasa Indonesia are welcome to do so. So the moderator will provide the transition and translation. And then please use the raise hands gesture or icon feature only during the discussion session. So when recognized, you may ask your question verbally after the moderator calls your name. So you can also ask using oral communication. Okay, thank you for your cooperation. And now the screen and the session is yours, Dr. Ishara. So you have 20 minutes to present your presentation. Thank you.
The screen is show up. The screen is show up now.
Yes, yes.
Okay. Okay, good morning, all participants and audience. So it is my honor to come to be the guest speaker today. So we will explore the important issues about the reproductive health in the elderly populations. So as I'm Associate Professor Isla Manilas, as you knowing that in the globals and also in Thailand, we are faced the rapid population aging. To understanding the address the reproductive health needs of the elderly has to become the important issues. As you can see here, globals, Asia's, also in Thailand, the percentage of the population age over 65 years are increasing over the time by times. And the proportions of elderly people is increased rapidly due to the declining of the fertility rates and the longer of the life expectancies. You can see the demographic transitions made is important for the policy makers and the healthcare provider to prepare the strategies that they address the needs of the aging populations. As you can see in these figures, before in Thailand, we have the TFR is about 6 children per woman in 1950s. But nowadays, we have about only 1.08, which is below than the repayment rate of 2.1. And here you can see the one of the main behind the Thailand's rapidly aging population is the significant declining of the total fertility rates, including the lowering the birth rate and higher of the elderly populations. And then you can see the age group 15 until 60s, or our workforce now also decreasing over the times. This demographic shift not only impact to the economics, productivities, but also have the great pressures on the healthcare system and the pensions funds. And this one, as I told you before, the TFR in Thailand, from 1960, we have 6.1 children per woman. But nowadays, 2023, we have 1.08, which is below the replacement level of 2.1. As you can see in this graph, we have the children's per 1,000 populations lowest from 20 years ago. Nowadays we have less than 400,000 baby born per year, only that. And the declining of birth rates is affect to the rising life expectancies. We have today, the average life expectancy in Thailand is about 79 years for the women and 72 years for the males. People are live longer because of the improvement of the healthcare, nutrition, and the living conditions. We have few births, but live longer. That's why we're talking today is about how it's linked to the reproductive health of the elderly. Here is the information from the Bangkok surveys. You can see the proportions of the workforce group reducing by the time. Similar with the children group 0 until 14 years, also reduced by the time. While you can see the age 60 up in Thai is increasing. We become the super age society by 2030, which we have the 28% of the population that have the age over than 60 years. And how it's linked to the reproductive health. And when you're talking about the reproductive health, normally the traditional views, we will normally focusing on the woman of childbearing age, right? We were talking about the contraceptive. We were talking about the pregnancy. We're talking about the childbirth. But however, in the today context, the definition is far too narrow. The reproductive health is not limited to the reproductive age. It is a lifelong concerns for both women and men. As you can see the definition of the WHO, the reproductive health is meaning that the state of the complete physical, mental, and social well-being in all stages of life. So it meaning that we must beyond this concept, beyond the reproductive health end. If it not ends after the retirement, if it not end after the menopause, we should focus or we should to recognize this concept to the healthy aging and human dignity across the entire life course. And here is the key dimensions of reproductive health among the oldest adults in Thailand. I divide into 4 aspects: physical or general health, mental health or emotional health, societies or accessibility, knowledge. You can see that for the physical or general health in Thailand, we are faced to the common health problems. For example, hypertension, diabetes, chronic disease, chronic conditions. While the mental, emotional health for the elderly in Thailand, we face for the loneliness, stress, reduce about the self-esteem. For the societies, we face about the limit availabilities of the health service. Many healthcare providers are not trained to support or to take care of the health concerns in older adults. For the last one is about the knowledge dimensions. Many elderly individuals are lacks proper understanding of their reproductive health rights. All of this, you can see that it is the common problems reproductive health in elderly. I think it's not only in Thailand, maybe it's in the global or internationals. And when I look at to the many researchers doing about comparing about the rural and urban disparities in the reproductive health of the elderly in Thailand. We also found the high disparities among the health conditions of the elderly. First is about the healthcare access rates. We find that in the rural elderly population, it have the chance or have only 25 until 30% to access to the healthcare system, comparing to the urban elderly population, which higher than 50%. When we're talking about the uncontrolled hypertension rate, we found that in the rural area, we found almost 60% of the elderly population have the uncontrolled hypertension rates, while comparing only 50% in the rural area. And not only that, we found about the delayed diagnosis of the dementias or Alzheimer's. We come to Alzheimer's later. We find that in the rural elderly patients are more likely to experience delays in the diagnosis of the cognitive disorder like dementias. Why is it important? Because the delay of the time is mean of the delay of the treatment and care. If we can diagnose the dementia of the elderly earlier, so the families or the healthcare provider can give the take care immediately. And then we found the disparities in the tailored medicines usings. In the elderly population, we found only 30% that access to the tailored medicines, while it's almost 50% in the older populations. All of this, you can see the disparities between the poor health outcome in the urban, in the rural elderly populations, comparing to the urban elderly population, to assess the gap so we can improve the healthcare infrastructures, we can enhance the healthcare accessibility, and we can to overcome the geographic barrier faced by the rural community. And what is about how is Thailand deal with it? Thailand COVID. We have the policy. We have the Thailand policy on the reproductive health and elderly care nowadays. We have the national reproductive health policies, and since 1997, and we have the second national strategies on reproductive health, which covered 2007 until 2027. But for the reproductive health, we're not focusing on only the workforce age. We also look beyond that. This policy is not limit any single age group, but also after retirements or or for all life of the populations. Inside the policies, the reproductive health care for the older adult, we're talking about we have the policies about the counseling for the older adult, because sometimes the sexual health needs or the relationship dynamics can change significantly. So the consulting service will help the older adult to address these concerns. And we have the screenings for reproductive health system related to the cancers, because older adults remain at least for the cancer related to the reproductive health, including the many cancer or prostate cancer in men. So if we are early detection through the regularly screen program, so it could be improve the treatment outcome. So we encourage all of the elder adults go to the check-up frequently check-up. We have the awareness check-up campaign for the elderly. And we have like managing the menopause syndromes, including the hormonal change, including to the mood functionals, functionals. We have the health service focusing on the syndrome management. We have the hormones replacement therapies. We have the consulting, lifestyle modifications. We have also the non-hormonal treatment to improve the comfort and quality of life. And then we also have the promoting self and satisfaction sexual relationship in the later life. To ensuring that the older adult can enjoy self and satisfaction to the sexual life in the public health priorities. And then we also have the supporting mental health related to the aging and hormonal transitions. Because of nowadays the mental health is challenged in the elderly adults in Thailand. For example, depression, anxiety, loneliness are the common issue in older adults. So we have physical consultings, we have the social support program, we have the community engagement activities, and then we also design the programs for the promoting the emotional well-beings. And then we also have some kind physical health, physical activity in each community to support or to reduce the mental health of the elderly adults in Thailand. And then we have also the USC. Maybe maybe some of you heard before. Is it the Universal Health Coverage? Universal Health Coverage, or we call USC. We pay only 30 baht or $1. So everyone can access to the healthcare service. Whatever you are, the children, adults, or elderly, so you have the fair and equal to access to the healthcare service. This coverage will help to reduce the barrier to healthcare access for the older adults. And then so all of that. So I just want to highlighting that nowadays for the proportions of the elderly is increasing over the time, not only in Thailand, but maybe it's surviving all around the world. And then Thailand also facing the problem that one, and then we try to have the policy to deal with the reproductive health in elderly. So only that, and then I'm looking forward to your comments or any question from you. Thank you. Oh, I have the last slide. Just skip it, okay? Is it the futures development plans? Thailand, we also have the next plan and 20 years national strategy for the elderly until 2026. We plan to develop the long-term care system for the older adults. We plan to improve the training caregiver because we know that it's really hard for the caregiver to take care of the elderly. And then we want to promote the community-based care service. Every community should have the based care service to take care of their own elderly in each community. Okay, only that. Thank you. I'm looking forward for your comment.
Okay, thank you very much, Dr. Dr. Siramanira. Sorry. Okay, so any of you would like to raise question using verbal communication, or the committee would like to share the screens of the accumulated questions or recorded questions? What do you think? I can also start from candidate Dr. Ignatius Gongo from Public Health Doctoral Program, University of UNS. Dear Dr. Ismaniza. Okay. So, dear Dr. Ismaniza, can you explain the good practice of collaboration approach between public health, occupational health and safety, epidemiology, and climate change to solve the problem in health? And then the second question. The second question from candidate Dr. Emerilia Tandilangi. doctoral students in public health, Faculty of Public Health Diponegoro University. She is focusing on occupational safety and health, and she is raising a question. It is truly an honor to attend this conference and to learn from the esteemed speakers around the world. With your kind permission, I would like to address a question to Dr. Ismaniza Ismail from University Technology Mara, Malaysia. What are the major challenges you have encountered in implementing occupational hygiene practices in informal sector, such as coastal fishermen or vendors who may not have access to formal occupational health system? And in the context of coastal occupational hygiene practices, how do you ensure the active involvement of local communities so that the approach remains sustainable in the long term? So there are two questions. Kindly, Dr. Ismail, Dr. Ismaniza, would you like to address those answers now, please?
So sorry, I was distracted one go. So this is a Q&A for myself. Hanifa?
Okay. Are you okay, Dr. Ismaniza? The connection
yes.
is okay? Okay.
Yeah, yeah. Okay, so do I just address all the questions straight away?
Sure. The two questions, please.
Okay. All right. So first of all, thank you very much, Ignatius Gongo. Yeah. Good practice of collaboration approach, okay, between public health or OSH, epidemiology, and climate change to solve the health problems. Yeah. Okay. This would be in terms of, okay, if you understand the basic concept of where does it fall into places. Yeah. Safety and health is the public safety and health. Okay. Occupational safety and health is also about safety and health, but in a workplace setting. Okay. So whatever that happens in a workplace may also affect the public. Okay. For example, if there is an explosion of a chemical factory, it can also affect the neighboring regions of the factory, which because it would release toxic vapors. Okay, and if it is what do you call that? If they discharge or illegally dump, okay, chemical waste into the nearby river, that's what happened in Sungai Kim Kim in 2019 in Johor, Malaysia. Okay, where it affects everybody in the neighborhood and people freak out because we were not prepared about what to do next. Okay, so that kind of thing happened, and from there, that is the turning point where people have started to pinpoint, okay, who is in charge of what? Because there are various jurisdictions. Everybody holds their own fort. Okay, for example, we have the Department of Environment, who is in charge of making sure that the environmental quality is in good condition. But that doesn't mean that they have to, what do you call that? They have to they cannot use the, what do you call that, the environmental quality standard limit for that purpose, because that is not a normal situation for public well-being. Okay, and neither that, we also have the Department of Occupational Safety and Health in Malaysia, and people were freaking out saying that, oh, okay, so now maybe we should follow that standard limit, but actually that is also wrong, because the exposure is not in a workplace setting, it is in the environment. Okay, so we also have the Department of Chemistry, we have the firefighters. Okay, what else? The National Disaster Department, okay, where everybody comes together and start to come up with strategies. We had a town hall to discuss this matter, okay, and come up with solutions to prevent it from happening in the future. Okay, so I hope that answers the question. Okay, Ignatius. All right. Next we have from Marilia Tandilangi. Okay, take namanya. Okay, major challenges in implementing OH practices in informal sectors, such as coastal fishermen or vendors who may not have access to formal occupation. Okay, so the challenges. Hold on. How do you ensure the active involvement of local communities so that the approach remains sustainable in the long term? All right, okay. Coastal fishermen, yeah, for example, or informal, any informal sectors. It can also be farmers. Okay, this is from my involvement going to a region which I prefer not to name in Indonesia. Okay, we were just trying to increase awareness by having a sharing session. Okay, and suggest interventions. Okay, and I would say two main obstacles when it comes to implementing this to informal sectors is that one is the awareness, okay, from the workers themselves, because they feel like we have been doing this for 30, 40 years, but we are used to it. There's no problem about it. So it's okay. We don't want to do anything about it. Okay, that's the first one. And the other one is the support from the regulators. Okay, from what we discussed, okay, during that session, we also have regulators and also the workers from the informal sectors, from the agricultural sector. Okay, the regulators said that we can't be too hard on them because it's hard for us to implement this. Okay, I would say you have only two options. Okay, whether you do it, okay, which means that you are very stringent, or you don't do it at all because you want to be lenient, you want to be flexible, you want workers to feel like you are still very nice to them, but that would also mean you are affecting their health and well-being. Okay, so those are the two main challenges. And I think it is not only in Indonesia, but also in Malaysia. It's also the same. Okay, when people think that, why do I need to do this when the regulators say it's okay? It's just like wearing helmets when, riding motorbikes. People say that, oh, it's okay. No, I don't meet with an accident. I've been doing this for a long time. No big deal. And maybe the regulators would say that, okay, whatever, you want to do it, do it. Okay, so it will not achieve the objective. Okay, how to ensure the active involvement of local communities? Whatever it is, it comes from deep within, which means that it comes from your awareness yourselves. Okay, if you feel like creating awareness is by spreading what has been, how has it affected the lives of the public, okay, then only they might realize that, oh, this is very important for myself. Okay, for example, long ago, yeah, when occupational hygiene started, there were many workers who experienced similar diseases. Okay, to those working as matchstick makers, okay, yang buat mancis ya, apa ya, mancis api, yang mau nyala api tu kan, okay, that one, they had fussy jaw. Okay, they had their jaw di sini jadi sakit. Okay. There were also workers who had diseases when they were chimney cleaners, chimney sweepers in England, okay, where they had scrotal cancer. Okay, that is the prevalent diseases among those workers. So when it is a big thing, it is common among those workers, then people would start to realize, oh, so I am also at risk to have this kind of disease. Then only they would try to protect themselves. They would realize that what is done by the regulators, by the researchers, what we try to advise them is actually valuable. Okay, so I would say the main thing is it comes within themselves. Even without formal education, if they feel like, oh, this is for myself, actually, they would do it. Okay, because even with formal education, for example, us, all of us, yeah, we have formal education in this field, okay, but we may decide to or not to follow it after some time. Okay, I myself, I learn about economics. Okay, but sometimes when I am too bogged down with my work, I might forego stretching. Okay, because I just want to get my things done, my work done. Okay, so again, it depends on how we perceive it. Okay, whether we want to decide to follow it or not. Okay, so Marilia, I hope that it answers your question. Yeah. Okay, Prof. Hanifa?
Yes, much for your response to this question. And the next question is from Tirto Besar, also candidate doctor from social science, Diponegoro University. How can behavior change communication and information seeking behavior by families reduce the incidence of mosquito-borne diseases? I think this is to be addressed to Dr. Ismaniza. Please, Dr. Ismaniza. One question from Besar Tirto.
To Prof. Isara?
Yeah. So, Dr. Isara. I think this is for Dr. Isara.
I'm not talking about the mosquito at all.
Oh, yeah. I think for Dr. Ismanisa, because it is related to environmental health.
Oh,
right?
okay then. All right.
Sorry.
Sorry about that, Dr. Isara.
Apologies for this.
Okay, behavior, change communication and information seeking behavior by families, reduce the incidence of mosquito-borne disease. All right. Maybe I can relate this with my experience when I got dengue a few years ago. Yeah. This is about actually if okay, if you live in a neighborhood, okay, which may be dengue prone, which is a common place for mosquito breeding, wild area. It's just like typically in my area, the regulators would come and check the area if there is any breeding ground, okay, any potential spot for breeding of the mosquitoes. Okay. However, keep in mind that how much do you want to learn about it? Okay, because you asked about behavior that change to communication and information seeking behavior. All right. Okay. So if you want to learn, you would try to seek the information. Okay. For all the other members, sorry, not the other members, the other neighbors in my where I lived. Okay, it seems like they just wanted to know why do they come for pesticide fogging? Yeah, pesticide fogging. That is just to as a preventive measures. How many times have they come, okay, to perform the fogging, right? Why is the case still increasing? Those kind of information seeking is good, okay. However, it should also come with thinking, okay. Keeping on asking people for questions, but if you don't get the gist behind it, it won't solve the problem. For instance, after I got dengue, okay, my house was visited by the what do you call that, the enforcers to come and check whether there's any potential breeding grounds, okay, whether there's a flower pot which may have water around it, yeah. But unfortunately, my flower pots even all withered because I was too lazy to water my plants. So it's not, there's no what do you call that? No potential breeding grounds in my house at all. Okay, so it could come from other places. I might have gotten it when I was outside, which is not in my house. Okay, so behavior would be in terms of where they want to learn. Okay, your willingness to know more. Okay, an inquisitive mind would generate ideas, would make you ask people more and help you to get more information. Okay, Tirto?
Okay, thank you very much, Dr. Ismaniza. And then the next question will be addressed to Dr. Isara. What is the most needed intervention to elderly, intervention on elderly to maintain their health in the community? So this is raised by Bapak Yudi. He is the secretary of the doctoral program of public health.
Okay. The question is, what is the most need intervention, right?
Indeed.
In my opinion, I think we cannot say that which one is it most needs intervention that should become first. I think it should be combination, 2 or 3 intervention that could be maintain the health of elderly in the community. The first thing in Thailand that we do it, we have the preventive and primary health service. For example, we encourage elderly in every community to regularly screening, check up. For example, we have a providing care service to check up every village, check up the elderly about the blood pressure, diabetes, visions, hearings, screening about the cancer. That is the first step. And then later on, we have some kind encourage to vaccinations. For example, flu vaccines, COVID vaccines, many vaccines that could be get the elderly have the maintain quality of life. And then not only that, we also have the health education, counselings on the nutrition, or we also have the exercise and medication. So for my opinion, I think it's something the most needs intervention is we have to be like a regularly screening. Let the elderly in the community come to check up and then know their health condition first. And later on, so they can prevent, they can treatment, they can improve their health later on. Okay.
Okay, thank you. And the next question from Ms. Novia Handayani. She is also the faculty at the Faculty of Public Health, Diponegoro University. She said, she asked about only a few people talk and really care about elderly's health, especially in reproductive health matters. So I'm curious about the cancer screening, such as cervical and prostate cancer. What are the government strategies to escalate the cancer screening program in Thailand? Okay, this is also, and then next also for Dr. Isara again, the presentation mentioned, this is from Mr. Dion, also Faculty of Public Health. And then the presentation mentions promoting community-based care services for the elderly. And then how are the community volunteers, caregivers being trained to handle reproductive health issues? What other role do they play in promoting awareness of sexual and reproductive health rights? So 2 questions for
Okay.
Dr. Isara. Kindly please respond to those questions.
Okay. To the Novia, as I already present earlier, we have the Universal Health Coverage, USC, that I told you that our government pay only, we call 30 baht, 30 baht every disease. 30 baht is mean equal than $1. You pay only 30 baht. Whatever you have the disease, cancers, many things. So you can go to the hospital and screening it. We call the USC for everyone in Thailand. So we have like cancer screenings for free of charge for the women age 30 until 60s. And also if you are later on, if you over the 60, you can continue to use the USC to treatment the cancer. And then we also have the primary healthcare centers and the communities healthcare across the country. So from the policy USC, you just pay only 30 baht or $1 and you can enter to the hospital or to the community primary healthcare service in your community, and you can treatment whatever cancer, you get the COVID, you get the flu, whatever the disease, so you can they will take care of you. So it's the strategy for the government. Let everyone equal. Whatever you poor or not poor, you came from whatever. You just need only the ID card, Thailand ID card, and then you enter, pay 30 baht, and they will take care of you. But if you are rich, you can use the what's it called, the large private public hospital. Is up to you. But if you not quite have any monies, you can go to the using the USC coverage program. Yes. And for the last question for Dion, about the community-based care service, right? Actually, in Thailand, we call Osmo. Osmo, it means the volunteer from the people who live in that community. Is it the local people that live in that community? We call the volunteer. And this volunteer, they will come to training with the hospital or with the primary healthcare service in that community. And this volunteer will become the community-based care service provider for the elderly in their community. And then they will they will training everything. First, they will training about the basics health knowledge for the elderly. For example, understanding about the health concern in the elderly. Let this kind of the volunteer understand about the conditions of the health concern in the elderly. And then they will have training the caregivings about health consultations, how to deal with the emotions of the elderly. And then they also promote the community talk, small group sections for each community. So it's some kind like our government, we have the strategy for the big one. The big one is we call USC. We pay only $1. Whatever the disease that you have, you can enter the hospital. And then we have like for the local community, for the rural area, we have like a volunteer in each community to take care of the elderly by using their own people in that community. They training, okay? And then they also have the what's it called, intensive each month for these people. Yes.
Okay, so the next question is also addressed to Dr. Ismail. So from Miss Wiwi Epe, the doctoral students in our faculty, so in coastal communities, such as traditional fishermen, the main problems are health problems like low back pain and skin disorders. They are also constrained by caste and access to healthcare. What effort should be made to address these issues? So, and then the second questions from Lucas Teadi, also doctoral students in our faculty. For the two speakers from Malaysia and Thailand, Dr. Ismaniza and Dr. Isara, how do your countries raise the role of the community, especially other health professionals such as practitioners, cadres, and health emergency issues, such as the latest pandemic? So, two questions. Please, Dr. Ismaniza Ismail, kindly address to respond to these questions.
Okay, thank you very much, Wiwi. Yeah. Okay. For the first question, which is on health problems, okay, among traditional fishermen, coastal communities, where they might have issues like musculoskeletal disorder or skin disorder. Okay. The issue is in terms of trying to access healthcare. Okay. What effort should be made to address this? I would say the first one is the community empowerment and awareness. Okay, this can be in terms of campaigns. Okay, maybe in terms of what the Ministry of Health can do. Okay, there can also be what do you call that? Government efforts. That would be the main one. Okay, where in Malaysia it's very common to have subsidized universal healthcare. Okay, we also have occupational health policies, which make it which is made compulsory for employers to look after employees. Okay, like health screening, vaccination, and things like that. Okay, but I know that in terms of coastal communities, typically they would be self-employed. Okay, so that may be a bit tricky. Mobile clinics and outreach services. Okay, this would be in terms of clinic desa, where all these small clinics would go into the remote areas to provide healthcare. It can also be in terms of having a cooperative initiative lah, such as where they can pool resources for health insurance schemes or emergency medical funds. Okay, in normal situation, they may not be a big deal. Okay, where maybe one or two workers get sick. Okay, but if it is in a group, okay, so the emergency medical funds or collective health insurance would be very helpful. Okay, they can also partner with NGOs, where NGOs typically provide free health camps, okay, or distribute safety equipment or conduct awareness campaigns. Okay, in Malaysia, we have various, I think about now more than 20 NGOs related to this field. Okay, whether you want to focus on occupational health or industrial hygiene or occupational safety or everything as a whole. Okay, so these NGOs maybe can help, right? In terms of preventive healthcare, maybe what we have had so far is the trainings. Okay, trainings maybe not frowned upon, yeah, but in terms of how is it accepted by the workers? Okay, but bringing in something that is new to them, okay, maybe attractive because they need to learn something. If we keep on saying that, what's the point of us going to coastal communities when they don't want to listen to us? Then it would stop there. Okay, but we can teach them how to prevent injuries, okay, in terms of safe work practices, how to properly handle equipment, okay, hygiene, and all these things are the daily thing that they face and they do. Okay, we can also teach them on nutrition and health awareness, and also access to affordable medication and treatment. Sometimes maybe we have telemedicine service. Okay, we can provide remote consultations where they can just call and ask for advice on what to do. Okay, those are amongst the efforts that I think can be made to address this issue. Okay. All right, for the second question, can I just pass to Dr. Isara to say something first, then I'll continue mine.
Okay, we help each other, okay? We are fighting each other today. Okay, the question maybe you meaning about the during the COVID-19 or not. I think it's like that, okay? Actually, in Thailand, the community is very play an important role during the COVID-19. We have some kind like a VHV. VHV, it means Village Health Volunteer. Village Health Volunteer, it means like the people who live in that community, right? They will have like a contribute important role like this. First, they will monitor. They will monitor and communication between each volunteer that they will door-to-door screening who get infections, COVID, who wants the medicines, and then they will report daily update to the local health centers around days. And then the next thing is they give the health education and risk communication. They will be give like a education in each house about like you have to protect yourself, you have to washing the hand, you have to wear the mask, you need the hand hygiene, physical distractings, and they also providing the community also providing about like the to list the queue for vaccination support. If anyone want the vaccine COVID, so they will give the list, and then there's some kind like survey that which how that need two vaccinations, because at the beginning, as you know, that when at the first time that the vaccination of COVID come to Thailand is most of the people refuse because the reputation they're hurting that after inject the vaccination, like they will get like some kind like makes them heart have the problem, so they refuse at the first time, and later on for 4 or 5 months they see that they did not have any effects, so they have many want to go to the set up the queue to have the vaccination. And then they also have some kind like mental health or social supports, because at the beginnings of have the COVID-19 in Thailand, they have a lot of people who lost their family, and then all of the hospital is full of the bed, and people have to live at home, and no one go out. So we have the policy like please give the distance and live at home. And as you know, like we live at home, one day is okay, next 10 days is not okay, because we live at home all day, and then we could not communicate with anyone. So we have like a mental health issue. So we also have the mental health social supports by using like video call, talking each other, because we cannot contact to anyone, right? And for me to sum up, in communities, volunteer in the communities help a lot. Help the healthcare system in Thailand a lot, especially in the COVID-19, because as you know that in the COVID-19, everyone have to lock down, right? We cannot go anywhere, but only for the people in the community that they know each other, and then they can going around there in village. Okay, yes. I hope this answer your questions.
All right. So I think I'll take over. Thank you very much, Dr. Isara. For Malaysia, in terms of raising the role of the community, if you talk about COVID pandemic, we did have many programs. We did have many efforts from the government and also the public. We had community volunteers, because we always, other than NGOs, we also have local leaders and also RELA. RELA is actually People's Volunteer Corps, where they are always involved in assisting and distributing aids, distributing, enforcing SOPs, making sure to complement what is lacking in terms of, if we need help in terms of the policemen, we might not have a lot of policemen at that time, but RELA is there to support them. Here, of course, we have communication campaign like nationwide initiatives. We have this Kita Jaga Kita, like we care for each other, we call it. Educated the public about the hygiene, mask wearing, social distancing, pretty much like what happened in Thailand. Digital platforms, and I think this is also applicable in all countries, where it enables self-assessment. We can assess ourselves whether we are okay today, we have some symptoms. It's also important for contact tracing and direct communication with health authorities. Other than that, we have frontline workforce expansion. Okay, because we redeployed healthcare workers from various states. Okay, we enlisted military medics and also engaged medical students to support hospitals. Okay, so that's the time when you know you are handicapped, you don't have a lot of workforce, but the time is crucial. So that's when we get all these people to help. In terms of training, training on infection control, in terms of PPE provision, mental health support. Okay, that is also people were playing their roles nicely, like trying to contribute, because it is not about just protecting ourselves. It's also about giving education to the public. Okay, there was also collaboration with private hospitals. Okay, because during that time, I remember all hospitals were fully occupied. Even it is one of the hospitals had 300% of occupancy. So that's, 3 times more than they are supposed to cater. All right. We also had community screening and vaccination program. Okay. Like local clinics and health professionals partnered with community centers where people come to get their jabs. And of course, there's also public feedback mechanism to report cases and for them to participate in localized containment strategies. So they feel like their voice is heard. Okay, they know that they can chip in as well. Right. So I hope that answers the question, yeah?
Okay, thank you. However, one more question from Miss Windu Sawalina for Dr. Isara. So this response duet from Dr. Isara and Dr. Ismaniza is very beautiful. And then now we still have one question from from Miss Windu Sawalina. So thank you very much for your inspiring presentation. I noticed that universal health coverage or UHC is one of the key strategies for achieving reproductive health goals in Thailand. So she's the master student from Gajah Mada University. So what are the main challenges in implementing universal health coverage for reproductive health in your context? And has the progress so far aligned with the set target? And then additionally, are there any notable collaborations or integrations with other sectors or programs to support this intervention, especially for adolescent or elderly? And then this would be a helpful insights for us in Indonesia. So Dr. Isan, would you like to address this, respond to this question?
Yes, you are true. They have a large problem in Thailand about USC applying because it's used for all Thai, like, and pay only $1. First of all, it's about the limited budget. Let me say like this. For example, if you sick, you get very high temperature. Actually, you need to admit, right? But when you use the USC, $1, doctor will say, oh, you will fine. You just take the paracetamol and then you can go home. You understand, right? But actually, you need to admit you will die soon now. Okay. But because of the budget, if they showing that it's not some kind like you can kill by yourself, you can treatment by yourself, you can at home like that. So they will be like because they limited the budget. So if not like a serious disease, they will let you go home. That is the fun thing. And the second thing is it's overcrowding. Because too many people using the $1. So it means you have to waiting long queue, waiting time. Sometimes, for example, you got the cancer. You need to operate maybe 3 months. If you don't operate in 3 months, the disease will be spit out to be stage 2, stage 3. But the queue is 2 years. Then what happened? You have to wait, right? Because this is the queue. And it's about the it's only government hospital who accept the USC coverage. Only the government. The government, it means we have like limited the doctor, limited the nurse, and then so it will be affect to the time that you have to treatment. And not only that, about the lack of the continuations of care, because it's the government's after the follow-up after you already treatment, to look after that, they're not someone who follow up you, because a lot of people. So, but for in my opinion, even they have a lot of problem like that, but it saves life of the poor people in Thailand a lot. And then I saw in my own eye that they have a lot of people who get the benefit from this 30 baht. They have the woman who pregnancy but not have money to give the delivery, so they enter to the 30 baht. So I understand that they have a large problem, but for me, I saw the advantage, because it's for the people who cannot enter to the private hospital that need that requirement a higher amount of money to pay of it. Yes. And then another question, right? They have another question, right? About they have another collaborations or integrate in this program or not, right? Actually, this USC is it for whole country, for whole Thailand. So this program, some kind like they are involved NGO. They also have the WHO, UNFPA, IPPF also involved with this program. And then not only that, and then they also have like collaborate to do the research, to monitor about the impacts or the policies of the USC, that is it effective or not, or flexible or not. They also have the research institute come to involve with it. So I think that it's some kind like national policy, so everyone is know about it and everyone is involved. Yes. That.
Okay, thank you very much. So now it's time to summarize all your questions and the response from the speakers. Allow me to share screen those summaries. I don't make a summary with regard to the presentation because you have the material. So I would like to summarize the question and answers. Are you okay? Okay, so here is the first is highlight the summary of the question and answer from collaboration in public health and occupational health and safety. Effective collaboration between public health, occupational health, epidemiology, and climate change sectors is essential. Example, addressing river pollution from chemical waste involves multiple departments, environmental, occupational health, and other departments who are working together to create these solutions. And occupational hygiene and informal sectors, this is also was addressed. Major challenges, low awareness among informal workers, for example, fishermen, informal vendors, and insufficient regulatory support. Sustainable approach requires increasing community awareness and active involvement. With regard to the behavioral change and mosquito-borne diseases, community-based behavior change and frequent inspection by health workers or enforcers can significantly reduce mosquito breeding and disease incident. And then for the elderly health interventions, a combination of regular health checkups and vaccination programs is the considered most effective. And then with regard to the cancer screening in Thailand, Thailand's universal health coverage provides equal access to services, including cervical and prostate cancer screening. And then for the training community volunteers, Thailand trains community health volunteers and caregivers to handle elderly health and reproductive issues, raising awareness of health rights. And then for the health issues in coastal communities, efforts include community empowerment, mobile clinics, government subsidized partnership with NGOs, preventive training, and remote consultation. And then for the challenges in universal health coverage for reproductive health, it was responded that the government takes role the time that you have treatment is handled by the government due to the 30 bahts of universal health coverage that provides the benefits for the poor people and for all. That is the summary, brief summary of your question that was answered and responded by the speaker. I hope this is useful to for your reference, for the participant reference. And thank you very much, Dr. Ismaniza Ismail and Dr. Isara Siramanairat. Your speech, explanation, and insights are beautifully addressed that makes the students and the participants gain knowledge with regard to those issues. I would like to congratulate on this successful question and answer and also discussion. And then I should provide you with the certificates. I'm waiting for the committee to share screen of your certificates. So this certificates is our appreciation to provide and proudly present the certificates to Dr. T.S. Ismaniza Ismail as a speaker, title Adapting Occupational Hygiene Practice to Enhance Resilience in Coastal Regions, for this 6th International Conference on Public Health, Tropical and Coastal Developments. By the way, I have to really make or train how to pronounce the TS actually. Is it Tengku or something?
Oh, I wish it's Tengku.
Oh, okay. So I'm so sorry.
No, no, it's
Apologies
okay,
for
it's
my
okay.
what we call it, unaware of the culturally very respectable that is Tengku Dr. Ismaniza Ismail.
No, that is actually technologies. That is for professional technologies. That is granted by the Malaysia Board of Technologies.
Oh, so this is a professional
Technologies.
title.
Yeah?
Technologies.
Technologies, yeah.
Okay, so it is kind of doctor technologies.
These are two separate entities. You know, doctor is for PhD and technologies is for the professional in terms of, you know, there are 24 categories where we are evaluated by the Malaysia Board of Technologies.
Oh, thank you for your explanation. Sorry. Okay, so thank you again. So we have some more understanding because of the law, what we call it, national title somehow should be addressed properly, but I failed to address this title. Okay, so thank you for your information. And then the second certificates. We would like to proudly present the certificates to Associate Professor Dr. Isara Siramani Rat as a speaker with the title Reproductive Health and Elderly. For the 6th International Conference of Public Health, Tropical and Coastal Developments, ICOPH-TCD 2025. Thank you very much. Okay, so thank you very much. So this is the session of the plenary this morning, the first plenary session. I would like to apologize if then in moderating this session there are some faults that I couldn't control. However, I tried to my best that this session should be fruitful for everyone. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
ขอบคุณค่ะ
Thank you very much.
Okay.
Terima kasih.
Ladies and gentlemen, the plenary session is over. Thank you so much to Professor Hanifa Mahardani, BSPH, MPH, PhD as our moderator. As a token of our appreciation, we would now like to present a certificate to Professor Hanifa. Professor Hanifa, would you kindly take a picture with us?
Okay.
All right, I will count in 1, 2, 3. Maybe one more time. 1, 2, 3. All right, that's enough. Thank you so much once again to Professor Hanifa Mahardani, BSPH, MPH, PhD. And also thank you for all of the participants who already actively participating in the plenary session.
Now, ladies and gentlemen, before we officially close this plenary session, we would like to deliver our deepest apology for Professor Dr. Yotin Sawangdi, PhD from Mahidol University's absence due to confidential reason. And now we would like also to deliver our gratitude for our sponsor of this event. This event is sponsored by BTN Bank.
Kini hadir Balai Solusi saat kemudahan dan fleksibilitas menjadi satu. Dibekali HR platform modern yang akan memudahkan tugas kamu. Memberi fasilitas terbaik bagi karyawan dengan bunga khusus BTN. Literasi dan perencanaan keuangan mumpuni, hingga berbagai loyalty program menarik, Kasbon digital, layanan khusus untuk kebutuhan mendesak sebelum gajian,
Ya, makasih.
dan pastikan layanan istimewa terpenuhi. Lengkap dan mudahnya ragam solusi ini hadir untuk apapun jenis usahamu. Bergabunglah dengan Balai Solusi sekarang. Layanan payroll, transaksi, pinjaman.
Dearest participant, after this we will be having the lunch and prayer break. But before that, let us inform you about the next session.
Ladies and gentlemen, the oral presentation will be held after the break. For the presentation, you will be divided into several breakout rooms as shown on the screen.
Ladies and gentlemen, please be ready at 1 p.m. or an hour after the break for the parallel session. That's all for the announcement. You may have your break now. See you later.
dancing queen.